watching Health Matters. My guest is a consultant, clinical pharmacist, and healthcare leader with decades of experience in hospital pharmacy and public health. She is the Chairman, Association of Consultant Pharmacists of Nigeria, and a passionate advocate for safe and appropriate use of medicine. She is Pharmacist Titilayo Onedo. Thank you so much for joining us on the show.
Thank you for having me. Good afternoon, viewers at home.
So we all know the essence of, medicines. We know we take medicines when we are not feeling well. We take some supplements when we want to feel, have optimum health. But when we talk about safe medicine use for the average viewer who is watching now, what does it entail? What does this really mean?
Okay, thank you for that very good question. When you talk about safe medicine use, you are looking at appropriate use of medicine so that this medicine can actually give the desired benefits and eliminate or reduce harmful effects associated with medicine. So you talked about the essence of medicine use, and I would want to elaborate on the essence of medicine use. The essence of medicine use is to prevent, to treat, and to control disease. Also, medicines are used to relieve pains. Medicines are also used to improve quality of life and sometimes to save lives. But you cannot be talking about the essence of medicines if medicine use itself is not safe. Because I talked about appropriate use of medicine, helping to optimize the medicine. So all the ones that I have listed about treating, prevention of diseases, if the medicines are not appropriately used, those things cannot be achieved. So when we are talking about medicine, safe medicine use, you are looking at the person now taking the right medicine at the right dose, at the right time, and for the right duration. And it must be under the guidance of an expert. And that expert is the pharmacist, who helps the patient to, make informed decision as to how these medicines should be taken so that the treatment is optimized and helps to prevent the unwanted effect associated with medicine use.
You've really said a lot in all of this, the timing for the medication, the appropriateness of the dosage, the kind of food, I think, is also very important in medication. So tell us about some of the common mistakes that you have seen that individuals make when it comes to their medication, maybe in terms of this medicine is not working as fast as I want it to. The doctor said, or the pharmacist said I should take one tablet. Maybe I could just have it, 1.5. It could help me. So let's talk about some of those common mistakes.
Okay. So some of the mistakes that are associated with medicine use is like one of the mistakes you have actually mentioned, when people feel their medicines are not achieving what it ought to achieve fast enough. They may be thinking maybe the dosage they have been given is inappropriate, maybe it's too small, and they want to, help themselves by topping it up. We don't encourage that. We don't encourage that should be done. Because for some medicines, the therapeutic window is actually very narrow. So if they should do that kind of thing, they may even, harm themselves. And for the other mistakes that people make, people share medicine. Somebody has used medicine before for a particular condition, and that medicine has actually worked. And somebody has come to you telling you, I'm presenting with this kind of thing, and when I had this, I was given this medicine. You could just, have maybe leftover, or even sometimes they turn themselves to prescriber and prescribe this medicine, and the person has gone out now to, source the medicine. We don't also encourage that, because when you talk about use of medicines, the use of medicine to a very large extent is individualized. And you are looking at the patient's age, you are looking at the patient's weight, you are looking at some other medical conditions.
Sometimes whether it's a male or a female too.
Yes. We are looking at the medical condition. Then we are looking at the kidney function and the liver function of this patient or the person as it were. And for some people, you may even actually present with the same medical condition. But for some medicines, even if it is the same medical condition that we are treating, a patient A may be able to use a particular medicine, a patient B may not be able to use. Even if
maybe even the dosage will be different.
Most times, that's why I said the use of medicine is actually individualized. So when a patient A has, let's say, is okay and has used a particular medicine without presenting any untoward effect, a patient B who probably had some kind of allergy may not be able to use that medicine, or is even taking some other medications that he or she has not disclosed, and there may be interaction. It becomes problem. There may be impaired kidney function or even liver function may be impaired also. So that particular medicine that has worked for her friend may not really be good for her, even though they may present with the same medical condition. Yes. Then storage too is a problem for some of the problems that we see with the use of medicines. Most medicines really should be stored in dry, cool place. But you see some people keeping medicines in cars, some people putting medicine on their windows where the direct sunlight may actually affect. You see some people putting medicine in their bathroom cupboards. So storage of medicine, because if medicines too are not appropriately stored, it affects the quality, it affects the effectiveness of the medicine. So we don't encourage, if you want to store, because some medicines, they have their own peculiar storage condition. So
some you have to put them in the refrigerator.
Yes. So it's always good for you to check the storage condition of your medicine. But most medicine should actually be kept in cool, dry place. And if you are unsure about the storage condition of your medicine, you should actually consult your pharmacist.
Okay, you are still going to say something, but I know that self-medication is another serious matter when it comes to medication. You see, I'm having headache. Sometimes that headache may be due to the fact that you've not taken enough water. It may be due to the fact that you're just hungry. But the first thing some people would do is to reach out to analgesics. So let's talk about the dangers of self-medication.
I would actually want to say self-medication on its own is not always bad. There are times that you would need to just self-medicate. For instance, you have maybe mild pain. You won't want to say, I want to go to the hospital. You will just reach out for a pain medicine and you use.
At what point do you reach out to analgesic, for instance, if you have mild pain? What are the parameters? What do you look out for before you say, okay, I need to take...
Okay, let us even say this, like the headache you mentioned. I'm having headache, and the headache sort of is even impairing your activity. You may actually use a pain medicine before you present to the hospital. Even for, let's say, someone that is having some kind of uncomplicated diarrhea, and you want to prevent dehydration, because the dehydration kills very fast. You want to prevent dehydration. There's nothing stopping you from using oral rehydration therapy.
Okay.
There's nothing stopping you.
So at what point does it become dangerous?
Yes, self-medication becomes dangerous now when you now start self-diagnosing, self-prescribing, and you continue using this medicine for a very long time. You begin to combine, maybe you are not having relief, you begin to combine medicines, and you are using for a very long time. The problem, it becomes dangerous at that point in time because you don't even know what you are treating. It may be some kind of serious condition that you are treating, and you may even be having some relief. Maybe you have relief after some time, these symptoms come back, you reach out for this medicine again, and you have used. You even may be masking the symptoms of very serious medical conditions. So that is irresponsible self-medication. But self-medication, like I said, is not totally bad when you are looking at it in terms of maybe self-care.
Temporary. Okay,
yeah.
This headache isn't going, I've eaten, I've taken water and it's still there. Okay, maybe I'm stressed, you know. But as they always tell us, in commercials, if after 3 days you don't get better, you should
consult your medical doctor. Yeah.
Okay. Now let's move on to checking expiry dates on medication. We all go, sometimes you go back to the pharmacy, you get some. Looking at, the expiry dates, how important is that too?
The expiry dates of medicines are actually very, very important. Is actually a pointer to the integrity and the effectiveness of the medicines. For some medicines, after especially if they are not even stored, if they are not stored appropriately, they might have even been degraded. So when you take up a medicine, you look at the expiry date. After expiration, we really don't encourage that it should be.
That is if the person even checks it. Because sometimes we have first aid boxes in our homes and we put some, medication and some things there. And maybe for a long time you've not been there and then suddenly there's an emergency or something and then you just reach out, not remembering that, maybe this thing's been here for like 1 year or more.
I would want to say if you have taken it up upon yourself to, have some kind of a first aid box, then it's you should be responsible enough to, periodically check the expiration of those medicines. Because I would want to believe that for somebody to be aware to that level of having a first aid box, that person should be,
it should. It's just
most times
we need to be conscious of it.
Yes, most times we do. We do check periodically, and what do you even store? Like I've mentioned, those are medicines for self-care that you store. You don't go about stocking so many things that you don't need because we don't even encourage it to. And for these medicines that are expired, the disposal too matters. We don't expect that you have stored medicines, the medicines are expired, now you want to dispose, you just dispose maybe into the drain, into the toilet. We don't encourage that. We expect that when the medicines are expired, you take the expired medicines back to the professional who have been saddled with the responsibility for safe medicine use, and that is the pharmacist.
Okay, let me remind our viewers that you can join us in this conversation. The number to call is on your screen, 080-8054-2233. Please join us in this conversation. Now let's move on to combining medications. Sometimes, you've been taking this anti-malaria, the malaria is not going. Just this agbo or this herbal concoction can also help. Let's talk about that.
For the herbal concoction, I would not want to encourage the concomitant use of herbal concoction with the orthodox medicines. And the reason being that for some of these concoctions, they have pharmacological effects also. Some of them have actually been demonstrated to have. So we don't want to encourage them using the normal orthodox medicines, and the reasons are some of them they do interact, and the consequences of these interactions sometimes may be fatal depending on the kind of interaction that has happened. And the belief with our people is that because it is not, most times these things are natural, because they are natural, they are safe.
Okay, just hold your thought. I think Kamal is trying to join us on. Kamal, thank you for joining us. Please go ahead with your question or comment.
Thank you. Good afternoon. So please, the question is, did she say that we should take the expired medicines back to the pharmacist? Is that what she said?
Okay, he wants to know, when you mentioned that we could take the expired medication back to the pharmacy, he wants a bit of more clarification on that.
Yes. Initially you got this medicine from pharmacy, from maybe the community pharmacy or the hospitals. The ideal thing is for you to take the medicine back to where you have gotten the medicines from, so that they can be disposed of properly. Because when you dispose of medicines inappropriately, it comes back to affect us. For instance, now let's look at maybe you have leftover antimicrobial agents and you have decided to go and flush down the drain. These things find their way back into the water that we drink, and it sort of encourages antibiotic resistance. And there are some other medicines too that have been demonstrated to affect the ecosystem negatively. So for some medicines, the way they are actually disposed vary from, depending on the chemical constituent. And it's the pharmacists that actually have this knowledge of how to properly dispose of this medicine. So that's why we are encouraging you, take them back to the place where you have gotten the medicines ab initio.
Okay, Chris from Warri, what's your question? Thank you for joining us.
The question is that I want to ask.
Hello, Chris.
So good afternoon.
Go ahead, please. Thank you for joining us.
I want to ask the question that might just be by the last caller just answered now. Now, when you take it to the pharmacy, is the pharmacy going to dispose it, or how is going to do it?
Okay, I think she answered that already, that the pharmacist is in the better position to know how to dispose. Thank you, Chris. Okay, we need to wind up now. If you have to leave a message for our viewers today on the program about safe medicine use, what is that one thing you do not want them to forget?
Okay, what I don't want them to forget, I don't want them to forget that, okay, the fact that a medicine, as it were, is of natural origin, like the herbal medicine that you mentioned, is safe. No, there is no medicine that is absolutely free of risk. So we should be very careful, because even what we see, the trend we see lately is this claims on social media whereby they tell you that, oh, it is because it is safe. You can even replace your medicine that you have been prescribed with this one, and it will do the work. No, we should be very careful about all those claims so that we don't get ourselves into trouble. If you have chronic conditions that they have prescribed medicines for you, it is good that you take the medicines the way they have told you. And if you think you want to take with herbal medicines, I think it is good for you to consult the pharmacist who sits you down, who explains everything, and at the same time you must also see the prescriber, so that the prescriber will know that you are already,
that is when you are in doubt, ask your doctor or ask the pharmacist.
If you are in doubt of your medicines, ask your pharmacist.
Thank you so much for coming on the show today. We've been having a chat with the consultant clinical pharmacist and the chairman Association of Consultant Pharmacists of Nigeria, Pharmacist Titilayo Onedo. Thank you indeed. I will wrap up the show with a look at stories from our news corner.
Healthcare workers in Katsina State, under the umbrella of the Assembly of Healthcare Professionals, have issued a 21-day ultimatum to the state government to implement outstanding welfare and professional entitlements or face an indefinite industrial action. The ultimatum took effect from Tuesday, August the 11th, 2026. The key demands include the immediate implementation of 100% CONHES as obtainable in federal health institutions, the skipping of CONHES 10 in line with existing circulars, and an upward review of the 10% hazard allowance to meet federal standards. The healthcare professionals are also seeking improved allowances for call duty, shift duty, clinical and non-clinical services, as well as rural and specialist duties, among others. The unions expressed their concern over what they described as government's prolonged failure to address their demands, despite several engagements and representations. The assembly comprises the Medical and Health Workers Union of Nigeria, National Association of Nigerian Nurses and Midwives, and the Association of Medical Laboratory Scientists of Nigeria.
We believe these demands are fair, justice, and necessary to promote the health care professionals and strengthen healthcare delivery across the state. Should the government fail to address this demand within the period of which this ultimatum, the Assembly of Healthcare Professionals, that comprises of all the mentioned unions above, excluding the NMA, shall have no option but to down the tools.
The Coordinating Minister of Health and Social Welfare, Professor Muhammad Pate, says partnerships with philanthropic organizations and development partners must align with Nigeria's health policies and priorities while strengthening sustainable domestic health systems. The minister reiterated this while hosting a delegation from a digital health organization, Maisha Meds. Professor Pate explains that Nigeria welcomes innovation and external support where they contribute to expanding access to basic primary health care, improving financing, strengthening supply chains, and supporting domestic production of medicines and diagnostic products.
Nigeria's fiscal federalism is very unique. And the governance of health in that context is very unique. And while it is mixed, there is the policy direction of government. We want to be sure that we're able to sustain it.
Finally, primary healthcare delivery in Kaduna State is receiving a boost as the state government, in collaboration with the United Nations Children's Fund, UNICEF, and Global Affairs Canada, GAC, deploys hospital equipment and essential medical supplies to selected primary healthcare centers across the state. The initiative is aimed at addressing critical gaps at the grassroots level of healthcare delivery and improving access to quality services, particularly for mothers, newborns, children, and young people.
The revitalization of our primary healthcare centers and the provision of equipment and essential supplies are driven by a simple but important objective to ensure that when a citizen walks into a primary healthcare facility, they find a functional facility, competent health workers, the necessary equipment and essential commodities to meet their healthcare needs.
We hope that this equipment will be able to strengthen the primary health care, and we want to assure the government of Kaduna State that we are always here, and we are very grateful that you are prioritizing the children who are aged 10 to 18 and also 19 as adolescents. And that's how we wrap up Health Matters for this week. Thank you so much for watching. Let's continue the conversation on all our social media platforms. I'm Yomi Otaigbe. I'll see you again next time.